So when a baby girl is born, she has in her ovaries all the eggs that she's going to have for her life. So from that moment, the number of eggs in the ovaries is reduced because she's waiting a given number of eggs every day and every month. And this number, these losses are increased when the puberty comes and then she starts having ovulation. So different women are having different rate of wasting these eggs. But there's a moment in which the number of eggs remaining in the ovary goes below a critical threshold. And we named when this happens, we say that the patient has a low ovarian reserve. And it is very important to identify women with low ovarian reserve because there is a direct relationship between the ovarian reserve and the chances of having a baby, both naturally and with IVF. We know some of the factors which are accelerating the rate of wasting the eggs in the ovaries. One of them is the lack of proper vitamin D levels in blood, which again have a relationship with the exposition to the sun. So we know that women who are not having a proper exposition to the sun or having a proper supply of vitamin D, they are wasting their eggs in a faster way. Means that their ovarian reserve is declining faster and their fertility is lower as well. So that's why it's very important for young women to check the ovarian reserve from time to time to identify when the ovarian reserve is going below that threshold. To advise about doing several actions that we can do in order to improve the fertility or to preserve fertility in some cases where the ovaries are having a very low number. Ideally, fertility preservation should be done before the ovarian reserve is very low because the efficiency then becomes really, really low. So we have to check the ovarian reserve in women frequently. We have to identify the patient having low ovarian reserve, and we have to offer fertility preservation or fertility treatments for those women who are having a low ovarian reserve at the earliest.